Okay, guys, let's start with the different aspects, discussing their features, and at the end, we will also see some clinical aspect of this tooth, that are the developmental anomalies. Okay, so first, let's begin with the labial aspect. So the labial aspect, it is trapezoidal in shape, the crown, even the lingual, but first let's discuss the labial. So the labial crown is trapezoidal in shape. The measle and the distal marginal ridges, the outline you can see, both are equal. They both are evenly tapered, and uh, there are in the newly erupted permanent mandibular incisors, there is this feature called the mammalions. Okay, the small protuberance over here are called the mammalions, and these mammalions are present on the incisal ridge over here, but due to the mastication of food and everything, the occlusal wear and everything, they are not present, but they may escape the wear due to some misalignment of the teeth. So these are the mammalions. Okay, and one more point is that the cervical line, it is apically directed like this, and the both the meso and the distal incisal angles, okay, both are sharp, and both are at 90 degrees. They are both are like sharp 90 degrees. Like if we see in the maxillary central incisor, we saw that the distal one was more curved, distal incisal angle was more rounded, but over here both the mesial and the distal outlines are equally tapered. They're sharp, and the meso and distal incisal angle are at 90 degrees. Coming on to the lingual, the crown is trapezoidal. Same, the meso and the distal outlines, they both are evenly tapered, and only this difference is that this is more narrower. Okay, so if you see both from the meso and the distal incisal angles, both these ridges, these lines, outlines come to the cervical part, but they taper more, okay, cervically. So the lingual aspect ka crown is more narrower than the labial. The labial is a bit broader over here. And yes, the lingual fossa. How is the lingual fossa formed? If you have seen my previous videos, it is same only. So the lingual fossa is bounded by the mesial and distal ridges, and the cingulum forms the lingual fossa. This is the lingual fossa. Okay, but over here, the difference over here is that this lingual fossa is smooth, and it does not have developmental groove. There was this developmental groove over here in maxillary central incisor, but there is no developmental groove, okay, in the mandibular central incisor. And next is the mesial aspect. So the mesial aspects, first we will just see the labial outline. So the labial outline, it is straight, except over here in the cervical it is a bit convex, and the height of contour of the labial outline is at the cervical third. Over here will be the height of contour, okay, because it is convex, so of course it will be the height of contour will be there. And in the lingual outline, it is concave over here in the incisal part, and as we come to the convex, it becomes at the cervical third, it becomes convex. Why is that? Because in the incisal part, the incisal third, there is the presence of what? The lingual fossa, and over here there's the cingulum. So that is why this irregular shape is there. And it is obvious where the height of contour will be. Over here in the cervical third, height of contour will be in the cervical third. So both here the height of contours will be in the cervical third, because this cingulum is present, that's why. Okay, so the distal part is similar to the Measle aspect. The only difference is this, okay, this curvature of the cervical line. In the distal side, it is 1 millimeter less curved, okay, over here. It is more curved over here in the Measle aspect. Now, coming on to the last one, the incisal aspect. The incisal, this one, the shape is oval. And how is it oval? Labiolingually, it is like this, it is oval. You can see over here also. Okay, like this, it is oval in shape. And another point about this aspect is that the labiolingual dimension is greater than the mesodistal dimension. That is why it is oval, like vertically. Okay, why? Because the labiolingual, okay, labiolingual dimensions are more than the mesodistal. Coming on to the, this one, the Measle half, the Measle and distal halves, both are equal. Why? Because we saw over here, both are symmetrical. All the features are symmetrical, they make it equal. Okay, so both the halves of the crown are equal from this aspect. And the labial aspect is greater than the lingual aspect. Why is that? So because there is a lingual inclination of the crown. The lingual inclination, okay, it is lingually inclined, tilted, okay, it is bent that side. That is why the labial side is seen more. That is why the labial is wider than a lingual surface. And this last characteristic feature I will tell you of this tooth, it is the main point. So what is the characteristic feature of this permanent mandibular central incisor, which differentiates it from the mandibular lateral incisor, is that you can see this ridge, incisal ridge. It is called the incisal ridge or the edge. So this is perpendicular to the line which bisects this crown labiolingually. Okay, so it is this characteristic feature. What is the characteristic feature? That it is perpendicular. The line bisecting the crown labiolingually is perpendicular to the incisal edge. Very important. Okay, put a star here. So remember this. And let's discuss about the root. So root is, as you can see, only one root, and the outline of the root is straight from the cervix up to the middle part, okay, and then it tapers apically. And the root is convex mesodistally and flattened labiolingually. So if you see, mesodistal root can be seen from the labial aspect. You have to actually, use your brain over here. You need to be logical. How will you see the mesodistal root like this? It'll be curved. You can't see the mesodistal root over here in the Measle or distal side. Okay, you can only see it in the labial side. So it will be bulged. Okay, it'll be curved. So the mesodistal root is convex. Okay, it is convex, the root. And over here in the labiolingually, the root is flattened. So you can see either from the distal or Measle aspect, the root is flat. Okay, and there are deep developmental grooves in the distal side. Okay, so both have developmental grooves. The mesial and the distal side have developmental groove, but in the distal side the root has more deeper developmental groove. All right, and usually, yeah, that's all. There are some variations of this tooth, but it is very rare. So there can be a small crown or a small root, or there can be bifurcation. So bifurcation will have two roots. And developmental anomalies of this tooth, there can be talons cusp, or there can be fusion between the mandibular central incisor and the lateral incisor. They can fuse the both the tooth, and this will become an abnormal condition. Alright guys, that's all for today. Hope you like the video. Thank you.